I've been in practice now for well over 30 years. I actually qualified in London from Westminster Hospital Medical School, which is now part of the Imperial College University Group. Well, I've been in the field of addiction now for nearly 30 years. The assessment process really tries to establish where the patient is, both from a psychological perspective and from a physical perspective. But in addition to that, we do need to incorporate the degree of motivation that the patient carries in order to sort of proceed to further treatment. And it usually works by involving both doctors, psychologists, and certain specialized therapists that will be able to establish where the patient is in his situation, how unwell he is, and how much he wants to get better. The medical team involves a physician that will normally treat the patient during his detoxification period. It will involve a psychologist that has specific experience and knowledge of the addiction process, and it will involve a psychiatrist that will be able to assess other areas of the patient's mental health that are not exactly addiction. The timing of and duration of a detox varies depending on the type of drug or substance of abuse that we have to deal with. Whereas alcohol can be in the order of approximately 5 days, if we're dealing with slow-release opiates such as methadone, this could easily be prolonged up to a period of about 10 days. The detox takes place in a clinic there is close by called Highcare Hospital. It's a small 12-bedded unit which is well catered for in terms of nursing staff, resident medical officers, and which allows us to have the patient in comfort with very beautiful surroundings and adequately supervised from a medical point of view 24 hours a day. Other medical problems during detoxification do come up every now and then with patients. We certainly try and deal with them at that moment in time, although we have to make certain that we have our priorities right. The priority is to detoxify the patient of their substance, and therefore non-urgent medical issues are normally delayed until later on, but can always be addressed. We do work with other specialists, and obviously the two most important other specialists are going to be the psychiatrist and the psychologist. However, we often need to get a neurologist involved. We sometimes need to get hospital physicians involved, and any other specialty such as radiographers, specialized nursing staff, etc., that may be required for other medical issues that arise. After you leave the detoxification clinic, the treatment plan is essentially a rehabilitation program. This will involve detailed psychological assessment, further medical care in a non-acute environment, and addressing the patient's life events in a more detailed process. Assessments in the country of residence will be possible. However, we may require a certain period of prior notice that will be required to address availability of the medical team that will need to come over to your country of residence. Assisting you from your home country to the rehabilitation clinic would be possible. We would need a certain amount of time to arrange for the team to coordinate them, to go out and escort you all the way back, yes.